Hey everybody, it's Jesse. It's been a long time since I have done a video, but I've had a rough time with depression over the past year, and I know that I've talked about my depression before. I've had it for a long time, probably like 15 years. But it got really bad, and I started to give up hope that I'd be able to find any solution. But I finally found a treatment that seems to be working, so I wanted to share it with you all, and maybe you all can find a doctor that does this kind of treatment as well, and it might help somebody else. So the treatment that I'm on right now is a product called Spravato, which is basically a nasal spray that's made from ketamine. Um, for me, at least, I found a place, a hospital, and a doctor that will administer it. And the way it works for me, this might be different in different locations. Different countries might have different rules. But for me, at least, I'm in the United States and I'm getting the treatment done in Pennsylvania. I take this. I go into the hospital. I take the nasal spray, and then I lay down. There's a blood pressure monitor and an oxygen sensor. I just lay down and relax for 2 hours while the monitors are on to make sure I'm okay. Then I need somebody to drive me home, and I can't drive for the rest of the day. In terms of side effects, I get a little bit dizzy, and sometimes I get a headache, but not really, it's not that bad. Um, the treatments are, for me, started out twice a week. So I had to go in twice a week for a month, and then now I'm in my second month, and I've dropped down to once a week. Um, I'm going to tell you about the experience of what it feels like after I take the ketamine, the Spravato, because it gets a little weird. But just in terms of overall side effects outside of it, I've had basically none. Um, there are side effects. I don't know what they all are, and I probably should say I'm not a doctor. I'm not a counselor. I'm just a computer programmer who has had depression for a long time and finally found something that works. After giving up hope, I found something. So I know there are other ways to have ketamine treatment that are also really effective. At least my doctor told me that. So they can do it intravenously. So it may be different where you're at if you try to find a place. But for me, my wife actually just did an internet search on Google for alternative or experimental depression treatments, and she found this. So it's pretty easy to find. Maybe she might even have typed near me at the end, and was able to find it. I know in my area there were several places that do it. I have to drive about an hour to get to the place to do it, but within that hour radius there were several places, I think, about as close, some a little bit farther away. So when when you actually get the treatment, it's it's a little it's a different experience. I would, if you've ever had anesthesia and you start to wake up and things just don't seem right, like they don't seem real, or things seem a little weird. That's the closest that I've ever felt to this. Some of the experiences I've had have been feeling like I'm watching my body move, or I'm listening to myself speak like it's somebody else and not me. Almost like I'm not in my body, like it's a separate thing. Having what seem to be very deep thoughts about time travel and teleportation. Um, Seemingly having a conversation with God at the time, which I am a believer, but I'm not 100% sure that it was God and not the ketamine. Um, Also, just once I thought, what it would be like to be an earthworm, and just imagine what it would like to be an earthworm, and came to the conclusion that it's a pretty good life, and I was totally comfortable with that. So it's an interesting experience, but you do feel a great sense of clarity when you think about your life and what's important in your life, and maybe that's what helps. Um, like I said, I'm not a doctor. I don't know the science behind it, but as far as I know, it works on a different neural pathway than than most other antidepressants. So I stayed on all my other medication, my antidepressants. I'm on Abilify and Cymbalta, right? I could stay on it, same dosage, no problems, because it works on a totally different pathway, right? Like there's like serotonin and something else I can't remember. Well, this is something totally different. So hopefully you could look up the science on this. I just wanted to share my experience and give you all some hope. So if you're somebody that's struggled with depression for a long time, you've tried different antidepressants, they don't seem to work, which is what happened to me, don't give up hope. There are these other treatments. They might even be near you. You might be able to do it. And in fact, my health insurance, which otherwise isn't really that great, actually is paying for the treatments. So even if you don't think your insurance is good, you might be able to get the treatments. If you don't have insurance, you might be able to get into some sort of testing, like trial program, in which case you wouldn't have to pay for that. I guess it depends on if trials are going on near you. But if anybody has any questions about this treatment, let me know. Like I said, I'm not a doctor, so I can't answer anything technical. But in terms of the experience, it started working for me after about a week. So about a week, I started to feel better. And after a few weeks, so let's say maybe after 3 weeks, I felt better than I have in years. And at this point, I feel like a totally new person. I feel like my old self again. My old self from back in my teens or early 20s before the depression got really bad. So it's amazing. I never thought I'd feel like this again. So I hope that maybe it can help you all, or at least give you some hope that maybe if this treatment isn't for you, maybe there is something out there that is for you. So if you have depression, or you know somebody has depression, I really hope this helps. And let me know if I can do anything else to help you. Thanks for watching. Bye.